There are over 100 known autoimmune diseases. Among these, the common autoimmune disorders are Hashimoto's thyroiditis, Graves' disease, Addison disease, systemic lupus erythematosus, rheumatoid arthritis, psoriasis, pernicious anemia, multiple sclerosis, and celiac disease. Sadly, these incurable medical conditions are way more common than cancers and coronary heart disease in combination. Conventionally, there isn't any definitive solution to cure, other than achieving disease control by knocking off the immunity of affected individuals with oral steroids and immunosuppressants that often come with potential long-term adverse health effects. With long-term immunosuppression, it's not hard to imagine the potential treatment-related complications, such as increased cancer risk and vulnerability to death due to simple infection. So, how do the autoimmune disorders come about? This boils down to the malfunction of a very important immune cell, called T helper cell, specifically Th14, which modulates and prevents autoimmune disorders. Together with B cells, both T and B cells make up the core of immune defense, which normally fight against foreign intruders. In autoimmune diseases, the immunity develops antibodies, so-called auto-antibodies, against itself, following Th14 overactivation, or dysregulation, causing mass destruction of affected tissues or organs. So, what the heck causing Th14 cells to become overactive? There are multiple theories being postulated to, sort of, explain the drive behind the activation of autoimmune disorders. The list is by no means exhausted. Firstly, Epstein-Barr virus reactivation, in the background of previous glandular fever, which takes over the control of host genes that activate autoimmune response. Secondly, a leaky gut syndrome. With the loss of protective gut wall integrity, foreign proteins that resemble own cells gain access into body readily, and trigger autoimmune response due to immune confusion. Thirdly, dysbiosis due to inappropriate use of oral antibiotics, or excessive intake of glyphosate-contaminated crops. The loss of friendly microbes increases vulnerability to autoimmunity due to foreign bodies' invasions. Fourth, mental distress such as losses, bereavement, and chronic depression. Chronic unresolved stressors trigger sustained release of endogenous cortisol, which increases susceptibility to autoimmunity. Fifth, kids raised in clean environment seems to develop autoimmune diseases at higher tendency. Well, this is attributed to a less well-trained immunity, so-called hygiene hypothesis. Sixth, a genetically defect in cellular vitamin D receptors, so-called polymorphism. In fact, pathogens like viruses attack vitamin D receptors to weaken immunity, to gain better access to humans' body. Vitamin D regulates immune system. Hence, malfunction vitamin D receptors not just put one at higher risk of weaker immunity, but also autoimmune activation. Last but not least, incidental environmental stimulation, such as chemicals, drugs, and toxins exposure. Surprisingly, the ultra-processed foods such as infant formula has been postulated as a risk factor for autoimmunity. As always, nothing is better than breast milk for healthy growing babies. Fortunately, there is something so-called epigenetic of T helper cells, as well as the difference in strength and resistance of one's immune defense to stressors, that drive some people's, but not all, to develop autoimmune diseases following a right environmental stimulation. Sadly, autoimmune diseases, like cancers, are generally considered incurable. Instead, we are talking about disease remission rather than cure. In other words, there is often risk of disease relapse with any modality of treatment. As autoimmune disease is related to overactive autoimmunity, immunosuppressive therapy is the core to the remedy in the modern convention medicine. Sadly, the use of chronic steroids and immunosuppressants poses not only long-term adverse health effect and toxicity, but the treatments are not meant for cure. Rather, the intention is for disease or symptoms control, while waiting for miracle of remission to happen. Now, what if there are better and safer remedies that are not just affordable and equally good in terms of disease remission rate? In summary, here there are: adequate daily sun exposure without sunburn to get vitamin D level up to minimal of 50,000 international units per day. Getting parathyroid hormone to the normal low is the therapeutic goal of vitamin D treatment. To consider bile salt supplements if there is concern of vitamin D resistance, so-called genetic polymorphism. People may develop vitamin D resistance, as well as Epstein-Barr virus reactivation, following overwhelming stress in life. Avoiding stress, and having good coping strategies to stressors, may be beneficial, in addition to taking adequate nutrients that support the stress response, namely vitamin B1, zinc, magnesium, and potassium, vitamin D, as always, plus regular aerobic exercise. Support your gut health and integrity by way of adequate probiotics and fermented pickles. Start low, and go slow, if small intestinal bacterial overgrowth is of a concern. Avoiding foods that are suspected to cause leaky gut syndrome, such as gluten, casein, nuts, or eggs, if any. Intermittent fasting and low carbs lifestyle, to pump up ketosis. Ketones strengthens one's immunity, and builds resistance to inflammatory damage. The fascinating fact about ketones is that, it's not just a preferred fuel to brain, it's also a potent antioxidant, playing a role in body inflammation protection. Last but not least, protomorphogen, a decoy, from tissue organ extracts, from other species, if available, may be considered as tool to drive autoimmune attack, away from own cells, keeping the affected organs transiently from friendly firing. Take-home message: vitamin D supplements, and intermittent fasting, are among the most important fighting strategies to consider, if everything else are not readily accessible. Perhaps one may not need a penny, to stay resilient against many chronic illnesses. Be disciplined, and stay active under the sun daily, and do regular intermittent fasting, to keep one away from autoimmune diseases.